Hi, welcome back. Today let's talk about urinary incontinence. What does that mean? Leaking of urine when you don't expect it to leak. It could be when you cough, when you sneeze, when you exercise, or just when you can't get to the toilet when you require one. Starts off with a small problem when there may be a drop or a dribble, but then for some people then whole of the bladder empties. That can become an issue. So when it starts to becoming an issue or starts affecting your life, we expect you to come and see us. Why do we get, or what are the reasons why we have this, and what types are there in this urinary incontinence? Many reasons are there. Sometimes you may have one-off episode of leakage, which we call it as temporary. The reason for that could be excess use of alcohol, caffeine, or carbonated drinks, very spicy or chili food, or very acidy food, chili peppers, chocolates. These are the reasons why you would get one-off. But reasonably regular, but your doctor would have warned you, could be because of your heart medication that you're on, BP medications mainly that you're on, or if you're taking large dose of vitamin C. Doesn't mean to say that for everybody it will happen, for every medication, BP medication it will happen, but some medications, yes, for some people it can. What else are the reasons why you may have temporary? The other things are urinary tract infection, or if you're constipated, that is very difficult to move your bowel. In that case also you may have leakage. Okay. Persistent urinary leakage, or the urinary leakage because there is a reason. What all could be? During pregnancy, the way the support is there and can alter, so you may have a little bit of leakage. If that is the case, most of the times it comes back and the leakage stops once you have had your baby. But yes, it is nice to talk to an obstetrician because we will tell you what to do and what to expect later on. Childbirth, vaginal delivery can damage the muscles there and hence can cause that. And then again, if once you go and meet with your gynecologist, they will explain to you what to do and what to expect later on. Changes of life. As we grow older, the muscle becomes weaker. The support system to the bladder and the bladder pipe changes. Because of this, yes, we can have problems, especially after menopause or change of life. Obstruction. There could be a stone there, which could be, or something else which can be obstructing. Hence, when there is a lot of urine in the bladder, it can overflow and the obstruction gets better. That, as well as there can be a damage to the bladder, nerve damage to the bladder, which doesn't say to your body that, oh, it is filled, so you need to go to toilet. So you don't know that your bladder is filled. That what happens when the capacity is filled? Obviously, yes, there will be a leakage. So these are all the reasons, or these are all the causes, types of urinary incontinence. There are different types based on when we have and how we have urinary incontinence. It could very well be when you are walking, running, coughing, sneezing. We call it as stress. It could be when you want to go to toilet, but you can't get to toilet and hence you leak. We call it as urgency and urge incontinence. It could be mix of these two, and we call aptly mixed incontinence. It could very well be because there is a problem in the bladder nerve and hence you might be having an incontinence. Why is it important? It's important because it affects people's life. People who are very active come back and start staying at home because of the leakage. It may smell, it may leak. Hence the hesitancy to get out. Elderly people might run to the toilet, rush to the toilet, in the process might fall and break their bones, which is a disaster. By and large, it affects the quality of care. It also has skin problems like rashes, skin infections, can also lead to urinary tract infections. So, we now know a lot about urinary incontinence. Can we prevent it? If so, how to prevent it? Yes, some of the urinary incontinences can be prevented for quite some time. The things to do are pelvic floor exercises. Yes, your gynecologist would have told you to do that as soon as you would have baby. But including myself, we have not done it for quite some time. So please start doing pelvic floor exercises. If you don't know how to do it, you can ask one of us, or you can even ask physiotherapist. Good diet, exercise, keeping hydrated, all works. Stopping irritant to your bladder. What are the irritants? Caffeine, fizzy drinks, most of the times some of the spices. These are the things that, and alcoholic drinks. These are the things that irritate your bladder. Don't smoke. If you're smoking, try and get help and stop smoking. So these are the things to help you to prevent bladder incontinence. So how do we diagnose that you have a problem? Most of the times with your history, and we may examine at the time and then see, ask you to cough, and you may leak, and obviously we will see that time. And on top of it, we will ask you to do urine analysis test to see what else might be the problem, because urinary tract infection can also give rise to this problem. We will ask you to do a bladder diary, which we will explain to you how to do it. We may ask you to get a scan done to check how much of urine is remaining after your peed. Sometimes we may ask you to do extra tests to see what kind of urinary incontinence this is. At which time what they will do is they may put a catheter in your bladder, they may ask you to pee on a scale, and they may ask you to fill the bladder up, and then they ask you to cough and see if there is any leakage. So these are all the things that we do to test, but that test, the last test, is rarely done, but sometimes yes, it is very important. So what are the treatment? Now that we have diagnosed what kind of a problem it is, so what are the treatment? How do we treat you? I would say that first and foremost is bladder retraining and pelvic floor exercises. You do that, only then we will help you with the other things. Double voiding is sometimes told to you if there is a urine already remaining in your bladder after you have finished peeing. And again, very, very important thing is fluid and diet management. Pelvic floor exercises, yes, we will teach you how to do it. You may be able to manage on your own. Sometimes if you already have an existing problem, we may say to you, please visit your physiotherapist to do the pelvic floor exercises, only because they know how to check you, make sure that you are exercising the right muscles that is required, and also help you to do extra exercise by putting some weight there and cones there and things like that, which is very difficult to be done at home. There are some medications for some of the problems, like if you have urge incontinence and none of the above have helped you, then yes, we can give you medications to help you. If the medications does not help in urge incontinence, there is something called as botulinum that we can inject to your bladder and help bladder behave better. There are other stimulators and etc. as we go higher up. For stress incontinence, however, there is a very good surgery, proven surgery, daycare procedure, tape surgery, which when put, it works wonders. If for the people who cannot get the surgery done because of physical conditions or mental conditions, yes, we can do other things like giving medications, but the medications have got a lot of side effects, and also we can inject things around the tube to have the same kind of effect as the surgery, but they are not permanent. Yes, what else can be done? Most of the other things are not treating the problem, but how to cope up with the problem. We may say how to manage it with fluids, how when to have, when not to have, a tablet or 2 tablets. If we know only when you have alcohol you have problem, or only during night time you have problem, we may change or play with your medications if it is just because of your BP medications. What else? We may ask you how to manage it, like maybe to move your bathroom or to move your bed where you sleep, or what kind of help, or how to use pads and things like that, or to get rid of smell or the urine water coming out. Very rarely you may need to put in a catheter, that is a permanent tube which will collect the urine in the bag. So these are the ways we manage the urinary incontinence. But most of the people, it is literally about your diet, your exercise, your food habits, your water intake. Again, some people, we may need medications and minor surgery and minor procedures. Very, very rarely we may ask you to put up with other things. Yes, it's a very common problem, especially elderly, but you don't have to suffer through it. We have lots of ways to make your life comfortable and make it worthwhile. Take care. Bye-bye. See you next time.